Hi everybody and welcome to another episode with The Anxious Resistance. Today I'm going to be talking about Cymbalta, also known by its generic name of Duloxetine. It is a medication used to treat major depressive disorder, generalized anxiety disorder, fibromyalgia, and chronic pain conditions such as neuropathic pain and osteoarthritis pain. It is classified as a serotonin norepinephrine reuptake inhibitor and works by increasing the levels of both serotonin and norepinephrine in the brain. So a little bit about the history of Cymbalta. It was developed by Eli Lilly and Company and was approved in 2004 for the treatment of major depressive disorder. It was later approved for the treatment of generalized anxiety disorder, fibromyalgia, and chronic pain conditions. So how exactly does Cymbalta work? What is its mechanism of action? Cymbalta works by selectively inhibiting the reuptake of both serotonin and norepinephrine in the brain, leading to increased levels of these neurotransmitters. This is thought to improve mood and reduce symptoms of depression, anxiety, fibromyalgia, and chronic pain conditions. So what is the evidence out there for its use? Cymbalta has been shown to be effective in treating major depressive disorder, generalized anxiety disorder, fibromyalgia, and chronic pain conditions. In clinical trials, Cymbalta was found to be more effective than placebo in reducing symptoms of these conditions. It has also been used off-label to treat other mental health conditions such as bipolar disorder and post-traumatic stress disorder. So what are the side effects of Cymbalta use? Like all medications, Cymbalta can cause some side effects. The most common side effects include nausea, dry mouth, constipation, and dizziness. These side effects are usually mild and go away on their own. However, if you experience any severe or persistent side effects, you should contact your doctor immediately. And I like to remind everybody when I talk about antidepressants, especially the SSRIs and the SNRIs, such as Cymbalta, sometimes the side effects go away over time. So you need to give your body time to adjust, get used to the medication, get used to the new levels of the neurotransmitters before you panic and quit the medication. So if it's not a serious side effect, keep trying. Stay in contact with your doctor or your prescriber. Make sure they know what's going on. If it is something that's severe, you definitely want to quit. But if it's something mild, you got a little bit of nausea, maybe some constipation, see if you can wait it out or even do other things to help manage those side effects. Okay, so Cymbalta can also increase the risk of suicidal thoughts and behaviors in some people, especially children, teenagers, and young adults. So please be careful if you see a marked increase in your depression, increase in your anxiety that's not tied to a life event or something else going on in your life. It may be due to the medication. So pay attention, close attention to that. Cymbalta is contraindicated in patients with a hypersensitivity to duloxetine or any of the components of the medication. It should also be used with caution in patients with a history of mania or hypomania, seizure disorders, and bleeding disorders. So what are some positives of Cymbalta or duloxetine? Cymbalta is effective in treating major depressive disorder, generalized anxiety disorder, fibromyalgia, and chronic pain conditions, as I've said before, and it also has some benefits in other mental health conditions such as PTSD. Cymbalta, and this one I think is kind of a big deal. Cymbalta has a lower risk of causing sexual side effects compared to other antidepressant medications. So a lot of people end up quitting their antidepressant because they just start to lose interest in sex. That can be really hard on relationships. And so this one having a lower risk of that is kind of a big deal. So if that's something that is really a big deal for you and you're having that issue with other antidepressants, then maybe Cymbalta is something worth a try for you. So what are some negatives of Cymbalta? It can cause side effects like any medication, and especially you can have some serious issues if you stop the medication abruptly. It may also interact with other medications, including some antidepressants and blood thinners. Cymbalta can take several weeks to start working, and its effectiveness may vary depending on the individual and their specific symptoms. So again, Cymbalta, like all frontline antidepressants right now, it does take time to work. You have to be patient with it. Again, the dose can be adjusted up and down a little bit, so you need to be patient with that as well. Again, it is some trial and error to find the right dosage that's good for you. It has the least amount of side effects and has the most gain. In conclusion, Cymbalta is an effective medication for treating major depressive disorder, generalized anxiety disorder, fibromyalgia, and chronic pain condition. It works by selectively inhibiting the reuptake of both serotonin and norepinephrine, leading to increased levels of these neurotransmitters. Can cause side effects. You do want to make sure you're always talking to your doctor, your provider, if you're experiencing any issues while taking Cymbalta. So overall, Cymbalta is a good medication. It's one of the most popular SNRIs that I see prescribed. I see a lot of Effexor, and I see a lot of Cymbalta. So it is a good option. It's something worth looking into, especially if you're having issues on SSRIs. Maybe you want to try an SNRI. Cymbalta is a great medication. Again, we use it all the time. If you learned something, you enjoyed it, like it, subscribe to our channel if you want to hear more about mental health medications and anything mental health related. And thank you so much for watching and for your support.